Good afternoon and welcome to PHCC's virtual program showcase, where today we are featuring nursing. Students joining us live, if you will please put your name and school in the chat feature. Also, if you have any questions that come up during the presentation, please enter those in the chat and keep yourselves muted until the end. We'll have a short Q&A session at the end for anything that isn't answered during the call. Today's call is hosted by the high school career coaches representing Martinsville, and this is the information just went over. These are your career coaches here. We're representing Martinsville, Henry County, and Patrick County schools. We are here to help you make informed decisions about your career goals and to help you have a successful transition into post-secondary education and training. We're going to briefly introduce ourselves before turning it over. My name is Alyssa Rohr, and I am the career coach for Magnetista High School. My office is at the front of the high school in the guidance area when we are in school in session. When we are not and we're doing things virtual, my office is in Philpott Hall at the main campus of PHCC's campus.
Hi, I'm Sharika Williams, and I am the career coach at Bassett High School. When I am at Bassett, I'm located on the small math hallway across from Miss Craig and Miss Yeaman. And when I'm at PHCC, I am in the Philpott Hall building.
Hi, I'm Christy Lester. I'm the career coach for Martinsville High School. When school is in session, I'm in the guidance department, and otherwise I'm on campus at PH in the Philpott building.
Hello, I'm Diane Hughes. I have an office at our DeHart Park campus in Stuart. I can meet with students by appointment there. Just email me to set up an appointment. I am also at Patrick County High School on Tuesdays and Thursdays right now, and office is located next to the cafeteria.
Thank you all. We are going to take down our screen. We'll put our information back up at the end of the call. I'm going to stop sharing here and let our Director of Nursing and Allied Health, Miss Amy Webster, is going to start sharing some information with you all.
All right, good afternoon. Let me pull up this information. It is not there. Hold on. Give me 1 second. Let's try that again. All right. So we're going to talk to you a little. I'm going to talk to you a little bit about the career nursing and whether it's right for you. Ms. Cox is our previous retention specialist, and she is now a nursing faculty position. And so she is the main developer of the information. So I want to just give her appropriate plug. What is nursing? You can see here that the definition from the American Nurses Association is nursing is protection, promotion, and optimization of health and abilities, prevention of illness and injury, alleviation of suffering through the diagnosis and treatment of human response, and advocacy in the care of individuals, families, communities, and populations. Sometimes we aren't sure if nursing is right for us, and so we kind of throw up this self-assessment just to see if there's any areas that interest you. These are all functions that the nurse participates with. We're problem solvers, we're listeners. We have to be responsible. We learn about the human body and how it works, and we like to learn about the human body and how it works. Just some examples. So if you look through this list and see a couple yeses, then nursing might be a good fit for you. There are lots of qualities for nurses: critical thinking skills, communication skills, compassion, detail-oriented, emotional stability, organizational skills, physical stamina. Nurses work in lots of different environments, but if you think about a hospital setting and 12-hour shifts, you're on your feet a lot. And of course, from an organizational standpoint, we have to prioritize care and meet needs of patients. And we're dealing with all kinds of patients, healthy to very, very sick. So just some qualities to look at. So why choose a career in nursing? It is rewarding. Nurses save lives. They help people. They make a difference. They're advocates. They usually put the needs of others before their own. There's a lot of job security with nursing. Lots of positions are open and available. And of course, it's a fast growing profession. It is a customizable career. Just simply, there's lots of different entry points for nursing, specializations after you graduate from nursing school. You know, maybe you want to certify yourself as emergency nurse or a critical care nurse, or a pediatric nurse. There's just lots of opportunities once you're in the profession. There's over 100 different nursing professions to choose from. Of course, we only have a few listed. Some nurses work in the home health setting, some work in labor and delivery, some work in public health, some work in psychiatric nursing, some work in the OR. So it just depends on what interests you. There's lots of different settings. Hospitals are not the only place a nurse works. You know, nurses work in community colleges, hence what I do. But they also work in schools. They work from home. They work in doctor's offices, clinics, outpatient areas, theme parks, correctional facilities, just a couple of examples. And then, of course, because patients in hospitals work 24 hours a day, 7 days a week, and they don't close, there's a lot of different flexibility with scheduling. But nurses a lot of times work night shifts, day shifts, weekends. They might be on call, and they do work holidays, especially since some of the environments in which they work don't close. They're open year round, and all day long and all night long. Salaries, if you're trying to get an idea of what kind of salary ranges a nurse makes, this is a nice snapshot and provides an example of what a certified nursing assistant through a practical nurse versus a registered nurse. And then, of course, it also looks at some of the national employment salary ranges. CNAs are entry level into the nursing profession. It's short-term training, anywhere from 4 to 6, 8 weeks. They work under the direct supervision of nursing staff. And of course, they work in a lot of the similar environments. They do have to become certified at the state level. Practical nurses, our program is 1 year. Those individuals, again, are licensed once they pass a licensure exam. They care for individuals in lots of different environments as well. And then registered nurses provide patient care, educate patients and the public. They tend to provide different levels of care, and they supervise LPNs and they supervise CNAs, but RNs are not all in a supervisory role because they also provide care. So just keep that in mind. As far as licensing goes, upon graduation from a nursing program, a graduate is not ready to go practice as a nurse. They have to be licensed. Licensing is an exam that occurs through, there's a national exam, it's called NCLEX. And in order to practice as a nurse, you have to pass the NCLEX exam. And state boards of nursing actually govern the license requirements in the states in where we work. And of course, nurses have to follow those guidelines and requirements, and they have nurse practice acts that are legal guidelines that the nurse follows that says what a nurse can and can't do in practice. You also have advanced practice nurses. Some of you have maybe gone to the doctor's office and saw a nurse practitioner. They might have a doctorate degree that makes them a doctorate of nurse practitioner, or maybe you've had surgery and you had a nurse anesthetist that assisted with your anesthesia. So there's lots of advanced roles for nursing as well. The program at Patrick Henry Community College, while we have a pre-BSN specialization, that's really a prep to transfer into a bachelor's program at a university or take prereqs for the associate nursing program on our campus. The community college is only allowed to award associate degrees and below. So we offer an associate of applied science, health technology nursing, and that's what they often call a registered nurse. But and then we have a practical nursing certificate and a certified nursing assistant pathway as well. And we also have a pathway for LPNs to become an RN. So lots of opportunities. The program has competitive entry. Applicants have to meet all the requirements. We give admission testing, and we're looking at the 50th percentile rank score. We have added that students also have to have a 50% on the science category of their admission test, and then they would advance through a rubric where we score and award points for different elements such as GPA, performance on the individual categories of the admission test, whether a student lives in the service region, and of course, some of their pre-application requirements like their science scores. We typically accept up to 30 students. With COVID, we've had to take less due to social distancing. In the practical nursing program, we typically take up to 20 once a year. The RN program is a 5-semester program. It's a prerequisite semester and 4 clinical semesters. The practical nursing program is 3 semesters. It's 1 year, spring, summer, and fall semester. So that runs January through December. And when we're offering CNA, that's usually 1 semester. And of course, in these programs, the courses have to be taken in sequence because they build upon one another. And of course, you have to meet the prerequisites and be accepted, particularly in RN and PN. CNA is first come, first serve. Students who apply to the nursing program also have to have an application on file with the college, be a high school graduate. Those of you that are seniors are eligible to apply during your senior year to the nursing program as long as you meet the prereqs. And so that's why we encourage you to meet with your career coaches, and I consult with them, and we all work together to make sure folks are ready to go. But pre-application, we're going to look at your high school biology and your high school chemistry grades. In the practical nursing program, we'll look at one of those, not both of them. We're also looking at math and English, whether you scored C's or higher, whether you had Algebra 1 and Algebra 2, and your GPA overall. When a student applies to the RN program, there are certain classes that have to be in progress when they apply. So this is where anatomy, English, college survival skills, public speaking, and developmental psych, they cannot be, they have to be in progress when you apply to the program if you have not previously completed them. So this is where dual enrollment students have an opportunity to try to take these courses ahead of time. And of course, some folks try to pick up some courses. If they're not offered by DE, they still try to take them through the college prior to applying, or they take them during their first semester as a college student after high school graduation when they apply to the program. So there's a couple paths there. We usually have 2 application periods a year, one in the fall, one in the spring. In the spring application cycle, folks are competing for a fall seat. In the fall application cycle, folks are competing for a spring seat. Spring starts in January. Sometimes that's confusing because it's in the middle of winter, but that's just college. The PN applications for practical nursing is once a year in the fall, and those kids also start in the spring. Nursing apps will only be accepted and processed during the application week, and those application periods are advertised on the Nursing and Health Science webpage. This is the wrong date. Oops, I made a mistake. Our next application week is March 8th through the 12th. March 8th through the 12th. And you can access that application by going to patrickhenry.edu/ADN application, and it's also accessible on the Health Career webpage. Let me see. We make those applications available a couple of weeks ahead of time, but they can't be turned in until the actual week. There is an essay response that students have to answer on that application. We do not have a waiting list, but we certainly don't accept every person that applies because we don't have room for them. So if you apply to the program and you don't get accepted, you can apply at the next application cycle. And then of course, with admission testing, you would either choose to use the scores that you had, or you would retest. And in most instances, if you weren't accepted, you would want to retest to try to improve your entry scores. The RN and PN applicants have to have the prereqs fulfilled. And of course, you also have other things that we look at, your Kaplan admission test for the RN program and the TEAS test for the PN program. Their time tests, they score certain avenues. They're looking really at your reading, writing, math, and science skills. And particularly for the nursing program as a whole, RN program, the science looks at anatomy and physiology. For the PN program, science looks at science broadly. So there's a lot of tools out there that you can use to refer to for studying. And of course, You can prepare by using some of the resources we have listed. There's lots of things through our library. Don't limit yourself to one study material. You know, if the Kaplan entrance test tests science with a focus in anatomy and physiology, don't be afraid to pick up the HESI review book, who has a whole chapter on anatomy and physiology, because that's just another method of reviewing. We want you to really prep for this, not wait 2 days before you take your test to prep. Spend several months in the preparation process of review so that you do your absolute best on the admission test. Program requirements: we do drug testing, background checks, we check health certificates, immunization records, CPR certifications. Nursing is a program that requires a lot of dedication and commitment, as does the profession. The drug test is something that has to be passed to be in clinical agencies. Background checks are done because the clinical agencies will deny students access to their clinical facilities. We look at your health records. Speeding through because I know we're going to run out of time. We also mandate that you have American Heart Association healthcare provider, or BLS CPR. That's something that can be taken on campus or outside of campus. We participate in clinical experiences in hospitals, long-term care facilities. We go to simulation centers. We go to doctor's offices, the health department. When we're in clinical, our students wear they're professionals, and they wear a nursing uniform that's a PHCC uniform. Folks that have childcare needs, transportation needs, and work, they have to build that around their school schedules. School has to be the priority. There's a lot of dedication, and we want you to be successful, but attendance is mandatory, participation is mandatory, and prepping for class, lab, and clinical is just something that you have to have a lot of time and effort to devoted to. If you decide you want to study 30 minutes a day, that's not enough. So keep in mind, in college, we say for every credit hour you're in class, there's 3 hours outside of class of prep work. In nursing school, we say there's 4 to 5 hours of study time for every credit hour you're in class. So that's just a big, broad, fast overview. So if you have any questions, I'd love to answer them for you.
Thank you so much, Amy. That was great. You answered all the questions, the pre-questions I had written out. So that was very thorough, even though I know you wanted to go quick through it. But do we have any questions from our students? I know we have one student on the call from Patrick County, looking to see. I don't think we have any in the chat feature. Coaches, do you have any questions for Amy? Well, we're going to put our career coach information back up. I'm going to share that with the students again. Can you see that? Someone give me a thumbs up. Can you see the information? Okay. We're here, the coaches are here to help you navigate the next steps after graduation. If you are interested in nursing, definitely speak to one of your career coaches. Send us an email. We'll help check off your list, make sure that you're going down the right path, taking the right things, that you have all the right paperwork in place to get you ready for that program, or any program. We're here to help you with your SEED, FAFSA, PH application, scholarships, registration, admissions paperwork, anything that you need, we're here to help. And we're ready to help. We're available to you. If you would like to connect with Ms. Webster and get more information, just reach out to us and we can help get you set up for that. If you'd like to come and see where everything is taking place, I know with COVID measures right now, we have to keep our students safe at the college, but we can, you know, maybe bring in at some point when things start clearing up and getting a little better, or share some photos with you, show you what the facilities look like. Any other questions? Anybody? Everybody good? Okay. All right. This program is going to be recorded and available for access afterwards. Thank you all for attending the call today, and hope you have a great afternoon. Thank you.